AndropausSpecialist.com, Section 3. About the Center. Michael A. Werner, M.D., FACS, is a board-certified urologist who received his specialized fellowship training in male infertility and surgery and male sexual dysfunction at Boston University Medical Center. He lectures and writes extensively on these topics in medical journals and books. Dr. Werner completed his urology residency at Mount Sinai Medical Center in Manhattan and received his medical school training at the University of California at San Francisco. He holds an undergraduate degree in biology from Harvard College. Dr. Werner's private practice is limited to male infertility and male sexual dysfunction. Hospital affiliations include White Plains Hospital, White Plains, New York; Westchester County Medical Center, Valhalla, New York; Montefiore Medical Center, Bronx, New York; Norwalk Hospital, Norwalk, Connecticut. Philosophy. State-of-the-art medical care. Medical advances that could significantly impact your treatment are evolving continually in the areas of male infertility and male sexual dysfunction. Because of Dr. Werner's highly specialized training and because he focuses on these areas exclusively, you will receive absolute state-of-the-art medical care. Being an active partner in your medical treatment. Dr. Werner strongly believes that you need to have a complete understanding of the medical options available to you. Similarly, Dr. Werner needs to be fully aware of your unique personal situation and priorities. Together, you will decide on the course of treatment that makes the most medical sense. How do we diagnose andropause? To determine if you have andropause, a blood test is necessary, and while it's true that decreased testosterone levels is a factor, other issues may weigh in. For instance, more sex hormone-binding globulin may limit testosterone from traveling to the tissues. Also, where testosterone levels would rise and fall when you were younger, you may now be experiencing a flattening and lower level of production. A few issues you should know. The definition of low testosterone varies. Generally, 2 standard deviations below the usual rate for a younger man is considered deficient. It's important to look at your testosterone levels over a period of time because they may vary from one day to the next. In older men, affected organs may respond differently to androgens. Also, there is no one right level of testosterone for all men. You and your doctor need to work together to establish the level that's right for you. It is accepted that if your testosterone is below 200 nanograms per deciliter, it's considered low. If it's over 600 nanograms per deciliter, then low testosterone is probably not the cause of andropause. What's the best way of measuring testosterone levels and diagnosing andropause? Opinions vary. The analog-free testosterone method is the most widely used by large commercial U.S. labs. We feel that a more accurate measurement is either free testosterone or bioavailable testosterone done in a specialty laboratory setting. While there is some variation in what tests should be used, it's widely accepted that blood work should be done prior to 10 a.m. to capture peak values. Interpreting testosterone levels is complicated. That's why it's important to see a physician experienced in this field who has a relationship to a specialty lab. It makes interpreting the results that much easier. First appointment. Diagnosing andropause. Your first appointment should last between 45 and 60 minutes. It should include history. The physician will take a thorough medical history in order to place your erectile dysfunction within a medical context. He will also take a full sexual history. This may include questions such as, how long have you had the erectile dysfunction? What happens when you try to have intercourse? Do you have decreased rigidity? Do you have difficulty maintaining your erection? At what point do you lose your erection? Do you wake up at any point with an erection? How rigid are the nocturnal erections? What is your sexual interest level, libido, like? Does your penis have a curve, bend, or twist in it when it is rigid? Is your ejaculation normal? Is it early, premature, or delayed? What is the status of your relationship? How is the relationship going? How is your erectile dysfunction affecting the relationship? Information. Your physician will explain to you how erections work, in terms that you will understand. He will explain why yours may not be working. Physical examination. Your physician will perform a focused physical examination on your penis and testes. In general, you should have a regular general physical examination either before or after your appointment. Evaluation. Your physician will usually measure the threshold for perceiving vibration of your penis, biophysio. Depending on your situation, he may perform specialized testing to assess the function of your penis. This may include an ultrasound to measure the blood flow through the penis, a Rigiscan to measure the quantity and quality of your nighttime erections, a blood test to measure your hormone levels. Once your physician has completed your evaluation, he will review impotence treatment options with you. He will consider these options in light of the history, physical, and specialized testing that has been performed. Required screening for andropause. People start hormone replacement therapy for a number of reasons, but once you begin the treatment, understand that monitoring it is a lifetime commitment. So far, there isn't a general consensus about how men undergoing testosterone replacement should be monitored. It is clear that those patients who have begun testosterone replacement for a particular symptom should have that symptom carefully observed. For example, a patient using testosterone because of problems with osteoporosis should have regular serial bone density screens. Patients with mood or libido changes must also be carefully evaluated. In general, we recommend that dosage begin low. Hormone levels and subjective impressions should then be checked 2 to 3 months afterward. If adequate blood hormone levels have not been reached, the dosage should be increased, and again, the patient should return in another 2 to 3 months for blood work. Our goal is to get you in the mid-range of the testosterone values. Once this has occurred, you will be monitored at regular intervals both in terms of symptoms and blood work. We'll be monitoring your blood fairly frequently. Once we achieve the right dosage of hormone, we follow your progress and draw blood every 3 months for at least a year. The following year, we evaluate you and draw blood every 4 months. Thereafter, appointments and blood work are required every 6 months. During the initial follow-up appointments, we evaluate you psychologically and physically. Blood work includes hormone levels, a complete chemistry profile including chemistries, lipids, fat profiles, and liver function tests. We also perform a complete blood cell count to check your hematocrit. An increased hematocrit is a common side effect of testosterone replacement therapy. It is important that you receive serial prostate exams at all of these visits, as well as a PSA test. It is also important to discuss any sleep disorders and to assess your mood, libido, and emotional state. This completes Section 3, About the Center.